Hi, I'm Rosemary Clay, host of In the Know with Row at Bergen Newbridge Medical Center Foundation. With recreational medical marijuana legal in New Jersey at state licensed dispensaries, there are still questions in the health benefits of cannabis. Today I'm joined by John Verbaro, who is the Chief Medical Officer at Bergen Newbridge Medical Center and an assistant professor at Rutgers, New Jersey Medical School. He is also the chief medical advisor at the Bergen County, acting as a medical director for all county public health programs. John, can you explain the current legal status in New Jersey for cannabis?
Sure. So cannabis in New Jersey is legal for what we call adult use, but people commonly call it recreational, but we actually use adult use because even people who aren't using it for a quote unquote prescribed medical reason frequently are using it for some medical benefit. So we call it adult use in that case. But that being said, the bigger and broader question is that cannabis is still a what's called a Schedule One drug on a federal level, and I'll explain what that means. Schedule One drugs are things like cocaine and heroin and so forth, whereas Schedule Two are things that can be prescribed. So fentanyl, which we know has a massive mortality rate, is actually Schedule Two, but cannabis is a Schedule One, and there's a lot of bad reasons for why that is, but that's the status of it. So on a federal level, it is a Schedule One. So a physician can't actually prescribe it. So when you go to a physician for cannabis, they don't actually write you a prescription. We can talk a little bit more about what that process is in the state of New Jersey, and in other states it's different. But every state has its own process for it. In the states where it is legal for medical use, there's some states where it's legal for medical use, some states where it's legal for both medical and adult use, some states where it's legal for neither. So, but in New Jersey, it's currently legal for both.
So, why does this all matter on the legal status?
It matters for a bunch of different reasons. One, like I said, the process in New Jersey or in other states is that a physician can't prescribe it because you're not legally allowed to prescribe a Schedule One drug. So what a physician can do in New Jersey, we say that they certify you for a qualifying condition. So there's a list of conditions in the state of New Jersey where you can qualify for medical cannabis, and you can see a physician who can certify that you meet one of those conditions. Now, not all physicians can do that. The physician has to be registered in something called the MCP, the Medical Cannabis Program for the state of New Jersey. It's actually NJMCP is what it's called.
Mhm.
It used to be called NJMMP, but we try to use cannabis instead of marijuana. We can talk about why. But that's the underlying piece to it. So one, the physician can certify you for it. In other states, they recommend you for it or authorize you for it, but that's the general setup for it. Why it matters is that it affects, and it's going to probably be a recurring answer in this talk today, that there's a lot of things we don't know about with cannabis, unfortunately, even though it's a drug and a medication that we've had for centuries. But part of the reason we don't is because of the legal status and some of the stigma around it, which has prevented us from getting as much information as we can. And I'm sure we'll get into more details as to what that means.
So you talked about a recommendation from a physician, right? What is
Yeah,
Can you give us some examples on what conditions would
sure.
qualify you for cannabis use?
So in the state of New Jersey, and it's interesting, it varies from state to state as well. So in the state of New Jersey, the list goes ALS, anxiety, cancer, chronic pain, dysmenorrhea, glaucoma, inflammatory bowel disease such as Crohn's disease, intractable muscle spasticity, migraines, multiple sclerosis, muscular dystrophy, opiate use disorder, HIV or AIDS, PTSD, seizure disorders, Tourette syndrome, and terminal illnesses. Now, I said anxiety in there. We're on the border with New York. Anxiety is not a condition in the state of New York. So
Oh,
it really, yeah. So that's why the legal status matters, because at the end of the day, you have a medication whose usage is being dictated by politics and not by medicine. And that's probably if without getting into much detail, that we've seen a lot of that over the last several years. That's usually not a good idea. So, but yeah, that's part of the issue, is that we don't know, or rather, we're limited based on the politics in the area where we are as to what conditions can be used. So in New Jersey, it's that list that I just read to you, but it varies from state to state. So if there's somebody watching this in another state, your list might be different.
So I'm sure there's some that are kind of, I want to say universal. They kind
Yeah.
of cross on all states. For
Yeah.
instance, like a terminal illness, correct?
Yeah. And there's three conditions where the evidence is very, very strong. Actually, more than that, but there's three general conditions, I should say, where the evidence is very strong for use. First is chronic pain. And so, there's probably the best evidence there. And in general, people can get about a 30% reduction in their chronic pain with cannabis use. Again, it's whether it's used for opiate use disorder or not, it looks like it's beneficial, but there's some question to it, because again, there's not a ton of research because of the legal restrictions to it. Also, nausea and vomiting from chemotherapy is commonly accepted to be very useful, and muscle spasticity from multiple sclerosis. Very strong evidence. The other one where there's extraordinarily strong evidence, in fact, it's FDA approved, is the use of CBD for a very rare type of seizure disorder called Dravet syndrome that's found in children.
Oh, okay.
Yeah.
Okay. So if someone is seeking to use cannabis as an alternative medicine, how would they go about it?
Sure. So you would, again, if you're using it for a medical purpose, you would find a physician. Again, if you're in New Jersey, you would find a physician who's registered with the NJMCP, and you would see that physician. They would do an evaluation of you. Now, what goes into that evaluation will depend on the physician, but most physicians who do it will do a true medical evaluation, like if you were going to the doctor for anything else. So if, say, you were going to the doctor for chronic pain, the physician would ask you the typical questions a physician would ask you about chronic pain. How long have you had the pain? What brings it on? Where is it? What's the intensity of it? What have you tried before? They'd get a full history of it and try to work with you to figure out what could be done and what could be recommended for you. And they'll try to guide you to it. But again, the issue is that they can't write a direct prescription. What they do is they authorize you, and then you have to go to a dispensary and pay cash for it. That's the holdup right now. But that's how it would generally work. So the physician would get a history and determine it. There are physicians who don't get a history. They usually charge cash to see them, so I won't comment on that. But not generally considered the most ethical. But generally, the physician will do what a physician normally does. This really should be treated like any other medication, because that's really what it is. There's about 80 active compounds in cannabis, and they're powerful medications. And the fact that we don't treat them like that is kind of odd. But again, a lot of history there. If you stop and think about it, almost every medication we have now originally started, usually it was hundreds of years ago in some other form, right? And this is going to sound strange that I know this date, but I'll explain why in a moment. On August 10th, 1895, they isolated acetylsalicylic acid from willow bark. Acetylsalicylic acid is more commonly known as aspirin. Probably the best medication known to humanity. It's the most useful, can be used for the most different reasons. It's like a wonder drug, really. If it were discovered today, they charge you a fortune for it. But and the reason I know that, by the way, August 10th is my birthday. That's why I know that date. But anyway, but that was, at one point, people chewed on willow bark in order to get the benefits of it. Digitalis or digoxin came from foxglove plants. Opiates came from poppies. There's all different things that are derived from a quote unquote natural source that we then studied and isolated and figured out the side effects and the benefits and the correct dosing and all of that stuff. And with cannabis, we don't have that right now. So that's part of the issue with using it, that it's a little more alchemy at this point of just figuring out what works for patients. But it is a powerful medication and drug. And we know that it's has definite positive benefits and it has some negative effects as well. And it's so right now the idea is to try to understand those and balance them, and if it's a beneficial medication for somebody, to use it in the correct manner.
So, can you explain to us what's the difference between medical marijuana and adult use or recreational marijuana?
Sure. I like I mentioned before, most people, there's an interesting statistic, that the majority of people who buy cannabis buy it for a medical reason, even if it's adult use. That doesn't mean the majority of cannabis is bought for a medical reason. The total amount, but most people are using it to treat something, even if it's a not diagnosed or not prescribed by a physician. So that's why we call it adult use. I mean, what we would call recreational use, again, is similar to how people use alcohol. There's an interesting thing when you compare alcohol and cannabis. In fact, actually, let me back up a piece. When we talk in medicine about drugs of abuse or drugs of addiction, most of them are lethal in either the overdose or in the in withdrawal. So, like for instance, opiates are lethal in overdose. Withdrawal is extraordinarily unpleasant. We know that, but it's rarely lethal. It can be in certain circumstances, but rarely is. Same thing is true of cocaine. Um, but benzodiazepines, things like Xanax and so forth, are, unless you mix them with something else, they're hard to overdose on. But the withdrawal is lethal. Among commonly used drugs, there's one that is lethal in neither, and there's one that's lethal in both. The one that's lethal in neither is cannabis. The one that's lethal in both is alcohol. But because of, again, social history, alcohol is commonly accepted and cannabis isn't. So, the adult use or recreational use is similar to what people use for alcohol. But then, like I said, there's also a medical benefit to it as well. So, but a lot of people use cannabis to basically self-treat some other medical issue, and you'll find that once you actually start surveying patients.
So explain what is the safe alternative. So if someone was to use recreational
Mm-hmm.
cannabis, can you explain the safest way?
So I don't know that there's a quote unquote safest way, but in terms of like what's the best method to take, it's interesting. When we announced we were doing this, a bunch of people wrote me questions that they'd like me to answer, and that was one thing that people asked, like, is it better to smoke it or to vape it or to take whatever? So no physician is going to recommend that you smoke anything, just because of the direct direct physical and chemical effects of smoke or anything inhaled on your lungs. So, from a health standpoint, smoking would be the most quote unquote dangerous, followed by vaping. Although, again, there's some medical circumstances where you would recommend a patient to vape it, but that's safer than smoking. The safest would be in some edible form. That doesn't mean baked goods, like I won't comment on, but the interesting thing is that cannabis was part of the commonly used pharmacopoeia in the 1800s prior to prohibition in the United States. And then it was commonly used as a tincture. Tinctures, you take a few drops of it. So tinctures or some kind of actual edible, and by that I mean like a capsule or a tablet or a gummy or something like that, is generally considered safer. Now, for people who use it, the absorption is going to be different. So the onset of use when it's smoked or vaped is generally within 5 minutes. With an edible, it's at least 30 minutes. So it's going to feel different for patients. But but that would be, from a medical standpoint, what I would say. It's a tricky question to answer, but like I said, no, a physician's never going to tell you to smoke anything. Just, there's always going to be something. Just the idea of taking some chemical into your lungs is usually not the best way to take it.
And I concur. I
Yeah.
totally agree. When you're thinking how sensitive your lungs can be.
Yeah.
So, can you tell us what some of the benefits of cannabis is, and what are some of the negative effects?
Sure. So cannabis, the way that it, as I mentioned before, there's about 80 psychoactive substances. The two most commonly known ones are, have been as THC and CBD in particular. The last probably 10 years, CBD has become something you hear about all over the place. They have different effects and they work on different receptors in the neurological system. Plus, there's other compounds there that, again, probably if we researched and isolated them, might have some benefits too that we don't know about yet. And some are probably deleterious. But, we know that some of these compounds are useful for certain conditions. Again, chronic pain, we know there's about a 30% reduction. We know that for the Dravet syndrome, like I mentioned, CBD in particular is somewhat of a miracle cure for those patients. It's a rare genetic epilepsy, and that was really the beginning of CBD being something very that you heard about a lot. Was when they discovered its usefulness for Dravet's, and it got picked up in the media, and that's when CBD suddenly became the cure for everything, which it's not. But it does have a lot of benefits, and it also, there THC causes more of the quote unquote high. Now, in low doses, it might be beneficial for anxiety. In high doses, it's not. THC can actually worsen anxiety, and there's a correlation in use of THC, in high use of THC, with things like psychosis and mania, especially when teenagers use it. Now, what's interesting is it's a correlation. We don't know if it's a causation. I'll explain what that means. Is that two things can kind of go together, but doesn't mean that one causes the other. Keeping on things that people smoke, there's a correlation between people who get into car accidents and people who smoke cigarettes. Well, if it was causation, you'd say, well, it's because they're busy messing around with the cigarettes and they get into car accidents. But it might just be that people who engage in smoking cigarettes might also not be as safe of drivers. So they might just be different signs of a similar thing. So it's not clear if the connection between THC and those psychiatric or mental health potential issues is correlation or causation, but it is a known strong correlation. So it's something that we do know about, and that again needs further research. The other potential side effects for cannabis are there are things like nausea and vomiting that can, even though it helps with nausea and vomiting in chemotherapy, it can cause certain disorders too. There is a cannabis overuse disorder, and it's well described. And you can see people have a cannabis withdrawal. It's minor, but they typically will have it about a week out from stopping if they were heavily using. There's also a syndrome that we see in the hospital called cyclical vomiting syndrome from people who overuse cannabis, who start vomiting continuously. It's not very pleasant. So there are negative side effects. It's not all peaches and cream. I don't want to make it sound like, oh, it's this wonderful mega wonder drug. On the other hand, it can be very, very useful, and it can help for treating things. Patients who have multiple sclerosis suffer with muscle spasticity, and this is a medication that helps them, or it appears to. Same thing, like I said, chronic pain. There's probably a use for it in opiate use disorders. It's not definitive because, again, we don't have enough research, but it looks like there probably is. Again, for CBD, it might even be helpful in anxiety disorders. Again, nothing is clear. So this is going to be me doing a lot of the doctor hand waving stuff. And it's interesting. Again, I think hopefully people have learned the last 2.5 years, something that I don't know if my fellow doctors have done a best job of explaining, which is that in medicine, the way that it works is that you get the information you have at that time, and you get more and more data, and you kind of narrow down what you think, and you kind of take this pathway to narrow down on the right answer. But it's never exact. There's no, unfortunately, it's like a joke. I've heard family members say it to me, like, do they teach all you doctors to say that, like, oh, well, every patient's different, all different? The reason is because it's true. You never know exactly. I don't know for certain that this is the medication that's going to save you. I don't know that this is going to work or not, but I know that overwhelmingly usually it does, and I know based on what you have that it's going to help. And with cannabis, we have a lot of questions still, so our range is very wide. So if it sounds like I'm hedging a lot, it's because I'm trained as a physician to never say definitively, like, oh, it definitely is, unless I am at least 95% sure. And I'm not 95% sure, but we have a pretty good idea. And so that's the one thing I think that we physicians don't always do well, is to make clear we have a pretty good idea. And we have a pretty good idea that cannabis is very helpful in a lot of these conditions, even if we don't know definitively. Same thing with glaucoma and some of those other conditions. There's a reason why they did put some of those on the list for the state. I don't want to make it sound like it's all political, but there is some logic behind it, at least a little bit.
It makes sense. And, going back to every patient's different, it's the truth. And, unfortunately, the other thing is, and please correct me if I'm wrong, the medicine might work for you, when you're in your 20s, and then you take it again in your 30s, and you can have a totally different reaction to it.
Absolutely. And yeah. And that's the other thing, is that even if a patient comes to a physician, sometimes they'll say something like, it might be one of the conditions that we don't have as much information on, but the patient will say, I use it for this and it helps me. That's, again, why the physician will typically try to get a history from you and try to narrow it down, because every patient is different, and you do need to get some of that history. So we do have a range of things where we think it might be helpful. We'll try to take that into account.
Makes total sense. So, recreational marijuana, pretty new, or, adult use marijuana, pretty new right now. I mean, it's less than a month old here in New Jersey. But medical marijuana has been, legal and being sold in state dispensaries. What's the difference between the two? I mean, I wouldn't imagine it's the same exact type of cannabis, is it?
No, it is. It is.
Okay.
It is. Now, in medical uses, we will sometimes some providers, especially those who are more sophisticated, will try to recommend to a patient a particular balance of compounds. So, you might have a physician tell you to use what's called a 1-to-1, which means, equal amounts of THC and CBD, or pure CBD, or pure one or the other. Because especially if a patient comes in using smoking whole flower, usually that's about a 10-to-1 balance of THC to CBD. And so they'll try to taper somebody down. So that's kind of the difference. But but the compounds available are pretty much the same ones from a dispensary. It's just that when you use it for medical use, they will try to gear it towards whatever medical reason you're using it for, to try to use a combination that they believe may help with it. There are some combinations that are felt to be better for certain conditions. So that's really what the difference would be.
So you mentioned THC and you
Yeah.
mentioned CBD.
Yeah.
What exactly is that?
Sure. So CBD stands for cannabidiol. It's a compound that's found in cannabis. THC stands for I wrote it down so I wouldn't screw it up. It's but it's a number first, and now I can't find where I wrote it down. But it's basically tetrahydrocannabidiol. There's a number in front of it, which I'm now forgetting. But THC is the compound that, again, causes the high.
Okay.
CBD is another cannabidiol in there, which is, again, just basically a compound that's found in cannabis. There are receptors for it in the nervous system, and they both combine to different receptors, and they can cause different effects. CBD, again, its direct effect is not totally understood, but we do know that it has certain beneficial effects. THC does cause the high. It might cause some other benefits. It also, as we said before, may cause some of the more harmful side effects as well. Such as the potential correlation with some certain mental health disorders, again, particularly in teenagers, and also for things like the cyclical vomiting syndrome and the withdrawal syndromes.
So you had mentioned something about, your provider or your doctor making suggestions on particular types of cannabis
Mm-hmm.
for, your reason of taking it.
Yep.
Can you give me an example of what you meant by that?
Sure. So again, if you were coming in for chronic pain, a physician may tell you we should try to aim towards, or for anxiety, we may try to aim towards you using more of a CBD than a THC. And again, a patient may come in to a physician saying, I use cannabis to treat my anxiety and I smoke whole flower. And what the physician would likely do is say, they again take a full history, authorize that you do have one of the qualifying conditions, but they may also recommend to you and say, like, look, we should really try to aim towards you not smoking whole flower, but using an edible or some other ingestible form, and we should try to aim towards getting a better balance between the THC and the CBD, because you probably need more CBD, which could actually lower the amount of cannabis you need to ingest by upping the amount of that and lowering the amount of THC. Because again, what's found that, again, this comes back to it's a powerful medication that we don't have well controlled. The balance that's in the flower might not be the best thing for the medical use, right? So they would do that. And then, the other question, I don't know if you're implying it a bit, has to do with different strains. Because again, this was something that a lot of people asked me about when we were leading up to this. There's different strains of cannabis. There's indica, there's sativa, there's a third one. But those are the two most people know. And people will tell you that different strains are better for different things. The issue is, again, because it's not well regulated or controlled, is that, and it's not by any malice from the people who are distributing it or dispensing it. When people have done tests on the genetic strains of things that are sold as one or the other, it's kind of muddled because, again, it's all bred and different lines of cannabis. So what somebody's selling as sativa may actually be more indica and vice versa. And again, that doesn't mean that anybody's doing anything bad or they're trying to deceive anybody. It's just because, again, there's no actual oversight to it, that even the distributors don't know what it is that they're growing. They know that this is supposed to be this strain, but they don't know where it came from generations down.
Right.
So.
Got it. Understood. So finally, as we wrap up, Doctor, what do you think the future of cannabis use is, and what's its place in medicine?
If it's not been clear, I'm actually a big proponent for medical use cannabis. And in particular, I think that we really need more research. I would love to see it get off of Schedule 1. That's a federal legal question. And again, I won't comment on that, but I would like to see it get off of that so we can actually do some real research and really understand what are the best, what are the best strains, what are the best balances of compounds, do actual studies where we figure that out and we do it on a patient. Somebody said, how do you know if an edible is sativa, indica, or hybrid? You don't. There's not a way to particularly tell. But I do think that I do think that the future is that this is a powerful medication, just like aspirin was once a powerful medication that was in willow bark. And as a physician, I would love to understand how to use it. There's so many potential uses for it, right? We know we're dealing with an opiate epidemic in this country, and that fentanyl is a Schedule 2 drug and cannabis is a Schedule 1 is crazy to me. Just, I don't want to editorialize, but to me, that's nuts. And particularly, when you realize that a lot of people developed opiate use disorders originally because of pain disorders. And when you have a potential medication that, again, just with our blind use of it, we can get in general, and 30% is an average, right? So that means that there's some patients who get more benefit, some patients get less, obviously some get none. But if we could isolate it better and understand it better, maybe we could treat pain a lot better and a lot more safely without creating them. Maybe there's use for it in treating opiate use disorders. We know that we are having a mental health crisis in this country. If there's a potential to use, whether it's CBD or other compounds in cannabis to treat those things, it just, that we have this drug that's been around for 100 years, that for a variety of reasons, and if you're interested in those reasons, there's a lot of good books you can look at them for, but that it was labeled as something that we didn't want to use, is kind of sad. But I do think in the future, I'm hopeful. I'm very hopeful because we've seen it become so much more accepted in the last several years. I'm hopeful that the stigma around it will decrease, that it'll become a Schedule II drug, that there'll be more research, and we'll be able to do more with it and be able to use it to help our patients. As a physician, my goal is always to have more tools to help patients with, and that's always what I'm looking for. So.
I agree 100%. And, it's nice to see that we're headed, I think, in the right direction, and that there's an alternative to, an opioid. So, for pain. So, so thank you so much for, joining me today and clearing some questions. I'm sure that a lot of people had on top of mind, and, because of the stigma, like you said, people are afraid to ask. So, this is great information. So thank you so much for joining us today, John.
Thank you so much for having me on.
Thank you again. Take care.
You too. Bye.